I'm seeing scoliosis as well.
Mm-hmm.
When did you find out about that?
About like when I was like 12 or 13. I did cheerleading a lot,
Okay.
so that's what like brought it on, I feel like. And they said I have like C and S, so it's like my back is curved in and like sideways.
So you got, all right, what she's saying, so everyone at home, so you got the curves this way and this way.
Yeah.
So it's like extended curves. So got a little bit of everything going on. What have you been doing to, I guess, try to help?
I used to go to a chiropractor and had like, I went, they said like 2 times a week if I can go, but I just stopped doing it because I had school and work and whatnot, so just...
You had life.
Yeah.
Okay. And so, so it's been a while. Now, what's going on? What do you notice the most? Because I'm seeing, all right, we got head and migraine checked off, neck, upper back, middle back, lower back, and knees.
Yeah, like my whole back is starting to hurt. I'm not sure exactly why. It was always my lower back, but my upper back's been hurt recently.
Okay.
And I just always had headaches.
Okay.
And when I was also younger, they said I had juvenile arthritis in my right hip.
Okay.
That was a little bit ago though.
All right. How often are the headaches or migraines?
It's pretty often.
Okay.
Probably like 4 times a week or so.
For how long?
It can last from like an hour to like 3 hours or so.
Really?
Yeah.
Oh my gosh.
I used to go to like a neurologist for it and everything. More so when I was younger too.
Okay.
So.
Any help, or what was done? What did the neurologist
They gave me like
do?
this medication that it wasn't supposed to like get it away like right away, like Tylenol or so or aspirin. But it was supposed to like slowly do it, so I kind of just stopped taking it because it didn't work. So I kind of just stopped doing it.
Gotcha.
I mean, after I graduated high school, it wasn't too bad. I feel like it's a little bit less stress.
Okay.
So it's not too bad that much anymore.
But now though, so you're still getting that about 4 times a week.
Yeah.
With headaches, okay. And the neck pain, the upper back, and the lower is the most, is the worst.
Yes.
Okay. Does the pain stay in the low back? Does it ever shoot down the legs?
It's more so in the lower back.
Okay. All right, let me have you stand up, please. Okay. So have you turn and face me.
No.
Yep. Let's go through some ranges of motion first. Okay. I want you to look all the way up at the ceiling for me. Any pain, tenderness, tightness, pulling, anything like that?
It's just a little tight.
Okay. Look down to the floor. Any issues with that?
No, it's just tight, like in my upper back.
Okay. Back to center. One ear to one side, and then to the other. What do you feel?
So tight, like right here.
Right there. Okay. And then if you rotate over either side.
The same type.
Same thing? Okay. We're going to drop down to the lower body. So I'm going to have you bend forward at the waist.
It's lower back.
Now, does that pain, is it staying there? Does it?
It goes like a little bit like...
So like
down.
a little bit like into the glute?
Yeah.
Into the hamstring?
Yeah.
Okay.
Kind
But
of.
does it pass the knee?
No.
Okay. If you extend back like this, any issue?
Lower back.
So it's staying there. And then if you bend in, laterally flex on either side. So it's all there. And then even rotation.
And that's more upper back.
More upper back?
Yeah.
Okay. Let me have you lay face down for me, please. And then I'll have you bring your hands right down here for me. Okay. Yep.
Okay.
Alright, so we're going to start off, we're going to scan the body. We're going to go from the cervical spine, checking the leg length, and we'll check the symmetry from the left side to the right side here, okay? So I'm going to palpate. Let me know if anything is painful or tender to the touch, okay? So we're going from that cervical spine.
Just tender.
Tender in the cervical spine? Okay.
Tender.
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 Tender to the mid-back, jeez, okay.
And tender down there.
Tender down
Yeah.
there, okay.
Yeah. Yeah.
Okay. Any pain over the...
Yeah.
Yeah, all of that?
Mm-hmm.
Okay. Let's come down here. Let's take a look at the leg length. The leg length is not the worst. It pulls, what is that, 1 millimeter, 2 millimeters short on that left side. So not much. Hips look good. Now it's through here is where I'm noticing the most. That lower back kind of on that right side is raised up, and then we got it raised up actually on the left side right in through here. Alright, so we're going to start up top here between that cervical thoracic junction here. Drop down just a little bit on that right side here. Good. Let me have you take a deep breath in and out. One more time, deep breath in and out. Good. recheck that leg length. Still short on that left side there. Better though. So before it was about 2 millimeters, now it's about 1. Let me have you sit up on the table for me, and then I'll have you straddle the table, so one leg on that side, one leg on this side. Perfect. Okay. So this, I want you to bring this arm up and over this shoulder, and then this arm up and over this shoulder. Good. Keep your eyes to the table. Okay. So we're going to rotate you this way. Look over this shoulder for me. Good.
Sorry.
Good. No, you're good. Alright, we got a little bit lower on that left side. Rotate you. Look over the shoulder, please. There we go. Lay face down again for me. Got a ton of movement with that. Oh, you're good. If you want to come in and look at the leg length is balanced. That's how it needs to be. Perfect. Let's check the sacrum. I'm going to stabilize right here. I want you to first raise that right leg up. Any pain or tenderness with that?
Not really.
Okay. Relax that side. Raise the left side. Now, how does that side feel compared to the right? You can relax that one.
Oh.
Or are they about the same?
Yeah, it's pretty much the same.
Okay. Let me have you lay on your side. Face me this way first. Bring this up for you. Good. So we're going to bend that top knee. Like this. Like
Sorry,
that.
what's that to do?
You're good, I gotcha. Right there. Perfect. Good. And we're going to have you flip to the other side. Good. Good. And lay flat on your back. Alright, from here we're going to do leg pulls. So with the leg pulls you'll feel some release in the ankle, the knee, going up to the hip. Relax your leg, okay? There we go. Going up. I'm going to have you stand up for me. Face me. Well, sorry, back to me. There we go. Bring your arms up. Yep. Let me get my hands under first. Yep, okay. So we're going to lean you back. I got you. Squeeze your elbows together. Good. There we go. And I'll have you take a seat right here, facing the wall that way. Okay. Bring this arm up and over. That one up and over. Good. Okay. Let me have you take a deep breath in. And exhale out. Good. There we go. And relax right there. Hands on your stomach for me. And now we're going to do the Y strap.
I'm so nervous.
No need to be nervous here. But yes, this is where you're going to feel that decompression from up top. Going all the way down. Can you have you lift your head? Good. And down. Good. Okay.
Oh shit. Sorry.
Deep breath in and out.
Thank you. That's like what I thought it would be. Sweet.
Now, what did you feel? So everyone at home understands it.
It felt like my spine was like this, and everything just kind of like a slinky. For the most part, it just went like out and then like back to where it's like supposed to be.
Good.
Instead of like tight. For the most part. Sweet.
Yeah, just relax for a moment. It's a powerful move. It's a ton of movement with that.
It's probably like a stupid question, but like, is that like your thing? Because I've never seen like a Y strap at any other chiropractor I went to.
So it's been around for over 35 years.
Oh, wow.
It was just not widely heard of. It's not a technique taught in schools.
Mm-hmm.
It is actually something that I learned from the first chiropractor that I worked for. He was the one who taught me how to do it. And then when he did it to me for the first time, that was when I was like, oh my gosh, why is this not being used more? Like, this was the best adjustment I've ever had. So then that's when I started researching it, really finding like in depth about it, and then obviously perfecting on, you know, the actual distraction itself and how to do it. And now, I mean, as you can tell, patients, they get the results that they're actually looking for with that. Come on up first. Come forward from it. Let me have you stand up, facing me again. How are you feeling?
I feel loose. Like, it was good.
Good. And then I'm going to have you look up, look down, go through those ranges of motion.
Yeah, it feels a lot better.
Feels a lot better.
Yeah.
And then bend forward at the waist.
Oh, it feels good. It's like the crack I'm like always trying to get when I'm like trying to crack my back.
Yeah.
It was like it like finally worked.
Good. See, this is how you should be feeling. Now, I guess because you do have experience of obviously other chiropractors. Obviously, you know, with growing up and knowing, you know, with having scoliosis. How was this and how are you feeling?
I feel like this is honestly like a lot better than what I had before because it's like a different type of crack you did, to be honest.
Yep.
Just a different way, like you did it. So it feels a lot better, honestly.
Good.
Thank you so much.
Welcome. You're welcome. I'm glad I could help.
Thank you.
Guys at home, literally, this is why I schedule those, you know, I post the videos and I schedule these appointments. People that you drove all the way from Charlotte to get here. And, you know, we have patients that travel from all over the U.S., actually even out of country to come here. And the reason is this works. Would you recommend this?
Oh, 100%. Yeah, like, come over here.
Perfect, guys. Have a good one, everybody.